So we are the only thing that stands between you and lunch.
No, there's one more
Except for that one more session.
Finish on time.
So we have to finish on time, so we have to start on time. My name's Jody Rich. I'm a physician at Brown University in Providence, Rhode Island. I've been there 20 years. One of the things I did when I got there, I was trained in HIV care, infectious diseases, was take care of people with HIV behind bars. So HIV really brought me into the prison and jail. And I've been doing that ever since. I've been behind bars every week for 20 years. Some people think that's remarkable. Some people say it's even more remarkable that I've been released from behind bars every week for the last 20 years. But during this time, I've had a front row seat to this epidemic of incarceration. As Tony West said, those with the highest risk and the greatest needs. So I've seen this river of humanity passing through this institution. And really, you know, when you look at that curve of incarceration over the last 30 or 40 years that goes up and up and up, and then up and up and up, and then has come down in the last years to here, and everybody says, oh, we're all done, it's already come down, where really we should be down here. This epidemic has happened on our watch, and is happening on our watch. And so we really need to step up and take care of this. You know, I'm just struck by how wrong this is. The rest of the world somehow has civilized society without incarcerating this many people. And now, don't get me wrong, there's plenty of people that need to be incarcerated. That's the best thing for them and for society. And but the vast majority of people, the people I meet day in, day out, don't need to be locked up. The second thing that really struck me is the tremendous opportunities for healthcare and for public health in this population. So not only with HIV care in Rhode Island, we were doing HIV testing fairly aggressively, and we identified a third of the people in the state with HIV. That is a big slice of the pie. And if we weren't doing that testing, they wouldn't have been diagnosed. They wouldn't have been linked to care. Their partners wouldn't have been tested. And now, decades later, we're finding out that all that linkage to care and treatment actually decreased the risk of people transmitting to others. So we not only got the benefit of diagnosing and providing the care, but actually getting those people to stop transmitting to others. And we've went from one of the worst states in the nation with over half of our cases of HIV related to injection drug use to one of the best. We have, last year we had only one new case of HIV related to injection drug use. We brought that epidemic to a halt. So that's the type of opportunities that we can find in corrections. Now, we formed a Center for Prisoner Health and Human Rights to try and address some of these issues. We have had occasion to look for funding. And when we ask people for funding, hey, would you like to fund prisoners? They say, prisoners? Well, maybe prisoners with HIV, maybe prisoners with breast cancer, maybe pregnant prisoners, maybe something. But the fact that they're a prisoner, that's those people, that's them. That's stigma. And usually they're not interested. Now, one of the favorite things I like to do when I'm going into corrections is to bring students and residents and trainees, and for anyone who wants to come to Rhode Island and look me up, and I'll take you in to see what it's like. But you know, the students come in and they look just like I did the first time you see these 14-foot high chain link fences with the razor wire and the doors that chung, just like the TV show, and the burly officers in the gray uniforms, and the whole thing is very intimidating. And you go through this maze of different doors and securities, and and then we finally get into the space that where I'm seeing the patient. And then you can see this light bulb go off over their head. They say, oh, I get it. This is not the TV. This is not the movies. This is not all this stuff is just a bunch of noise. What's going on here is this is a person. No different. This is a person seeing their doctor, talking about their health care. Now, the situation is very bizarre and it's artificial, but this is just a person. When we look at those tremendous numbers, we kind of forget that these are just people, and they have families, and they have unique situations and diseases and problems. And so, you know, I think that's the thing that gets lost all too often. Now, a couple of years ago, the National Academy of Sciences put together a study on the causes and consequences of high rates of incarceration. That study has been going on for a couple of years now. Brought together a bunch of experts, and at their first meeting they realized we don't have anyone on the panel who knows anything about healthcare. So I happened to be in the right place at the right time, and I was fortunate enough to get on that committee, which has been a very interesting experience. We were able to put together a workshop on health and incarceration, and that was published. The whole thing is sponsored by the NIG, MacArthur, and Robert Wood Johnson. And that 600-700 pages is about to be released at the end of this month, last estimate I heard. So I want to put a plug out for that. And I think some of the messages, even though it's not focused on health, in that report and some of the recommendations are going to resonate with a lot of things that you've heard today. Now, what we'd like to do is improve the healthcare, improve the linkages, and both inside corrections and outside for this same population. And so really we've got to be very smart about using these resources to leverage, to put the right incentives into the healthcare system, both the correctional healthcare system, as if it's a system, and the people that are going to come out afterwards. And we're going to hear some more about that the rest of today. But I would argue that we also need to define the right incentives for the whole criminal justice system. That you know, the prosecutors are now incentivized to get more, get more people locked up, get more time. The judges are, get tough on crime, and the politicians are disincentivized. Thankfully, there's some movement in the opposite direction, but I'll be tough on crime, so vote for me. And you can have a great program to let 10,000 people out, and the 10,001st person that gets out and creates some heinous crime, 180 degrees. Okay, whose idea was that? He's out of office, and we got to lock up more and more people, and not realizing that these actually are people, and you're destroying lives and ultimately society. So, in the healthcare, as healthcare providers, we have a status, and we have a strength, and we have a duty to advocate for our patients, advocate for this population. And we can change not only the healthcare provided, but I think the whole system. And I think that's really what we need to do. We have an outstanding group of speakers for this panel. If I can find my notes, I might even know who they are. So, first we have Dr. Dolores Burrows Byron, and they have impressive resumes. I could spend the rest of the morning, if I did find my notes, talking about them. But she is currently the Health Services Director at the Vermont Department of Corrections, and I liked her right away because I noticed that she became a nurse. And some people have this feeling about doctors, well, we don't really trust them. They drive the fancy cars. But the nurses, we always trust the nurses. So she was a nurse before she became a doctor. And then she's been doing great work in Vermont. And I'm particularly interested in hearing about her in light of her governor's State of the State address. Then we have Paul Samuels, Director and President of the Legal Action Center, who's really been a pioneer in advocating for legal, creative strategies to address many of these issues: addiction, HIV, and incarceration, and many other related issues. And Kathy forgot to shave this morning, but we also have Kathy Jett from the California Project. Pay no attention to that man behind the curtain. But Kathy is unfortunately unable to make it today. So with no further ado, Dolores.